Is it normal for cats' noses to be wet? When you boop your cat or kitten's nose, you may notice that the little snout is damp. Is it true, however, that cat noses are supposed to be wet? Yes, a cat's nose should be wet rather than dry, much like a dog's. But it's a little more complex than that. Hey everyone, welcome back to our channel. In this video, we will be talking about why cats have wet noses and if it's as normal. And before we start, make sure to hit the subscribe button and turn on the notification bell. Done? Let's get started. The noses of cats are usually damp and they may even feel chilly. The moisture of a cat's nose aids in him detecting odors and determining where they originate. This is also true for dogs. Moist nostrils have an advantage because scent particles attach to wet surfaces more quickly than dry ones. Cats, like dogs, have a smell gland called the Jacobson's organ located above the roof of their mouths. They can detect odors by breathing through their mouths, and they may sometimes hold their jaws open in a sneer to get a nice whiff of aroma in their mouths. The Flyman reaction is what is called. Some believe cats lick their noses for the same reason dogs do, to increase the amount of scent particles in the Jacobson's organ. Others, on the other hand, believe that cats lick their noses to clear out any residue that may be interfering with their ability to detect scents. If your cat's nose is dry or heated, it isn't necessarily a sign that he or she is ill. His nose may feel dry if he has recently brushed or licked it. If he has been sunbathing himself under a window, it might also feel warm and dry. A particularly dry nose could indicate that your cat has developed a minor sunburn on his snout. Some cats have a nose that is inherently drier or warmer than you are accustomed to. Your cat's nose, on the other hand, may get especially frigid if he becomes too chilled. If your house is particularly cold, consider a self-warming kitty sack or a nuzzle nest. If you want a heated bed that plugs in, try a Thermo Kitty Fashion Splash. Try a Thermo Outdoor Kitty House for outdoor kitties in cold climates. Instead of focusing on whether your cat's nose is dry or wet, pay attention to the rest of his or her behavior. If she is losing energy, appearing lethargic, eating less, acting abnormally thirsty, or showing signs of digestive problems, consult your veterinarian. If your cat's nose suddenly changes from its natural state and remains that way, you should consult your veterinarian. A warm nose that could be normal for a short time, or it could indicate that she is dehydrated or has a fever. If you suspect your cat isn't getting enough water, a flowing water fountain could help. Alternatively, a K&H clean flow filtered water bottle for cats with a huge reservoir attached will ensure she doesn't run out of water. A problem can also be indicated by excessively wet noses. If your cat's nose is wetter than usual or has an odd discharge, she could be suffering from a cold, allergies, or another problem. You should take your cat to the vet if she appears to be congested with breathing or has a wheeze she didn't have previously. While your cat's nose should be moist and somewhat cold to the touch, a warm and dry nose does not necessarily indicate that your cat is sick. Simply ensure that your cat is well cared for and receives enough of fresh water and nutritious food. If you see other indicators of illness along with a change in your cat's nose, you should consult your veterinarian. It is necessary to be concerned if your cat's nose is running. It all depends on the circumstances. While some runny noses can be readily cured, they can sometimes be an indication of a broader health problem. Read on to find out what causes cats to have runny noses and when you should take your cat to the doctor for treatment. A runny nose in your cat is most usually caused by inflammation, trauma, or infection of the tissues in their nasal canals or sinuses. However, if your cat is snotty on a regular basis, they may have an upper respiratory infection. According to Merck Veterinary Manual, viruses such as herpes and caliciviruses cause the majority of upper respiratory infections in cats. Bacterial infections such as Chlamydia, Felis, and Bordetella bronchiectatica are the second most prevalent causes of runny noses. Thankfully, if your cat has had all of the necessary immunizations, the chances of their developing these infections are much reduced. Aside from simple upper respiratory infections, which are usually mild and don't require treatment, there are a few other reasons why your cat's nose is running, including number 1, rhinitis or inflammation of the nose. Rhinitis is a condition in which the nasal passages become inflamed and resulting in a runny nose. An upper respiratory tract infection, bacteria, a virus, and less commonly, fungus can all cause rhinitis. Allergies are another potential, but they aren't a prevalent cause of rhinitis in cats. Number 2, foreign bodies. When a cat inhales a foreign body such as a piece of food or a strand of yarn, he or she may have a runny nose with colorful discharge. Number 3, nasal cancer. In cats, this type of cancer can be very aggressive. It can start with a runny nose, but it can quickly proceed to face puffiness, thick or colorful discharge, pain, and congestion among other symptoms. Number 4, bloody nose. A bloody nose can be caused by clotting issues, malignancy, foreign substances, or an inflammatory illness. Number 5, trauma. A blow to the nose can result in a bloody flow that clears up when the swelling goes down. Traumatic nasal discharge can also get infectious and turn greenish yellow. Number 6. Toxic irritants. Toxic irritants can cause significant nasal irritation and inflammation, resulting in a runny nose. And number 7. Nasal polyps. These benign growths can produce a runny nose, sneezing, and congestion. It's not necessary to rush to the veterinarian just because your cat's nose is running. A runny nose is usually the result of an infection that will clear up on its own or part of the regular nasal clearing process. Sneezing, nasal discharge in red and runny rise, coughing, oral or nasal ulcers, sniffles, fever, and hoarseness are the most prevalent symptoms in cats with runny noses. These symptoms are commonly associated with upper respiratory tract infections and necessitate a trip to the veterinarian to guarantee your cat's health. Severe eye swelling, crimson or greenish discharge, significant fatigue, a high fever, poor appetite, and difficulty breathing are some of the more concerning symptoms to watch out for. Cats with these symptoms may just be suffering from a bad cold, but they are also at risk for bronchopneumonia or possibly cancer. If you observe any of these symptoms, take your cat to the vet immediately once. The importance of early therapy cannot be overstated. If your cat's runny nose causes you concern, you should always visit your veterinarian. While a runny nose might or sometimes just be a runny nose, the possibility of it becoming a larger health concern is worth seeking professional advice to keep your kitten happy and healthy. Before offering treatment recommendations, the veterinarian must first discover the etiology of the problem. Nasal discharge analysis and blood testing can help your cat's veterinarian figure out what's causing their runny nose. If therapy is required, they may prescribe an antibiotic or another drug to help clear the nasal passages and relieve congestion. They may also suggest utilizing nebulizer equipment which uses vapor to deliver medicine. Finish your exam with a lovely brushing session if your cat enjoys being brushed. Brushing helps to remove loose fur, distribute lubricants, and increase blood flow. Brushing can also aid in the prevention of hairballs, which can occur when cats swallow too much fur while brushing themselves for another cat in the house. Never give your cat any medication without first consulting your veterinarian. Aspirin, acetaminophen, cold medicines, anti-cancer pharmaceuticals, diet pills, and antidepressants are just a few examples of human medications that can poison cats. Even vitamins have the potential to be harmful. Request a referral from your veterinarian for a book on cat care that includes a section on emergency first aid. While you should never try to be your own veterinarian, you may learn some emergency practices that will help you prevent damage and make your pet comfortable while you're waiting for the vet. Now is the time to get educated, even if you're traveling with your cat. Keep a simple first aid pet kit on hand. You'll be grateful, and so will your cat if something goes wrong. Did you find this video informative or helpful? Let us know in the comment section below. Don't forget to like and share. Make sure to subscribe so that you don't miss out on any of my future uploads and videos.